Okay, class. So welcome back. In this part of the lecture, we'll kind of get into more specifics about the epidemiology in physical therapy practice, or the epidemiology more specific to physical therapy practice. So I like this graph here by Stevens, which published in 2014, which illustrates one of the points we had alluded to earlier, that if we look at the prevalence of hypertension or cardiovascular disease in this study, you find, of course, similar rates that we've seen across the literature, that for individuals with no disabilities, right? So general population, we're looking at prevalence, but anywhere between 25 to 30%. However, if we look at individuals with disabilities of any kind, whether it's hearing, vision, cognitive, and especially mobility, the prevalence increases. And again, you think, what's our role here? How does this intersect with the physical therapy profession? Well, I'd say treating patients with mobility limitations is kind of what we do, right? So again, we talked about in the previous lecture, we look at age breakdown. We're probably going to see it, given the age of the populations we treat. We typically work with older populations, even in outpatient and especially in inpatient or home health, right? If we look at, again, demographics, in terms of physical inactivity, right? In obesity, pretty common, contributes to hypertension. Probably going to be seeing this in our clinics. But if we even get to specifics of, now we're moving into the rehabilitation, data, or rehabilitation specific data, it's quite clear that this is again something fully within our wheelhouse and something very present within our profession, something we need to be aware of, and we need to be screening in order to ensure the safety of our patients. Probably the most important thing as a licensed provider. Now again, this is disabilities broadly, again, this higher prevalence. Now I'm going to show you some data that is very specific to PT practice. So my colleague Sarah Arena out in Oakland University, she surveyed, and she's done a lot of work in home health research and blood pressure screening. She found that 75% of patients in home care physical therapy had either blood pressure measurements suggesting either they had pre-hypertension or hypertension, and actually probably be even higher for pure hypertension because of the numbers, the guidelines have shifted. We actually have a lower cutoff for hypertension diagnosis. But either way, pretty shocking, right? 75%, right? So again, it's something you're going to see pretty common. This is independent of their diagnosis. So those are just patients who had, maybe a joint replacement or a stroke, right? Which you would expect some hypertension because of the contributors of cardiovascular disease to, stroke. 80% of them are ischemic related. And again, independent of pre-existing diagnosis. It could be any condition. What's concerning is that a known diagnosis of hypertension was only present in 43%, meaning close to 60% of that survey found that patients didn't know they had hypertension. A bit of a concern. Again, speaks that asymptomatic, speaks to the importance of screening to ensure safety. Now, our study, which was published in 2019 in PTJ, found that outpatient physical therapists, and we surveyed therapists nationally, we had over 1,800 responses, very large database, found that close to 70% of outpatient, these are primarily orthopedic physical therapists. Again, this is not home health. This is not SNF. This is not rehab hospital. This is not high medical complexity. This is your typical outpatient clinic. 70% of outpatient PTs reported they encountered a new patient with or at risk for cardiovascular disease. So they had 2 or more risk factors at least twice a week. 30% reported they encountered a new patient with or at risk for cardiovascular disease daily. This is something you're going to encounter. And again, we look at differences in terms of perspective with red flag screenings, right? People, if you say, which is cancer, Again, serious condition, incredibly rare to encounter in PT practice. But yet, if you told someone that to not screen for cancer, they would look at you like you had 3 heads. Cardiovascular disease, incredibly common. Yet, as I'll show you in a few slides, the screening behaviors just aren't where they need to be, as well as some of the narratives that are associated with those behaviors. 50% of PTs reported that at least half of their current caseload included patients with or at risk for cardiovascular disease. Again, it's incredibly common, and there's data actually from the chronic pain research, which suggests that individuals with chronic musculoskeletal pain are 2 times more likely to have cardiovascular disease than those without it. And again, we'll go over this theme of the common patient that we're seeing, right? The people coming to our clinics, right? We look at things through silos, but it's a lot of your patients with obesity have chronic pain. A lot of your patients with obesity have low back pain. These things kind of run together, and we're seeing it over and over again. And I'd say, I'm working outpatient practice, and talking to my colleagues around the country, around the world, they'd say this is consistent. That it would be almost rare, even in an outpatient clinic, that you would encounter someone without risk factors. And again, thinking about the populations we're treating, people who aren't moving more or as much, people who've got maybe some risk factors. In fact, if you look, there's been other studies, I think by Fritz and other individuals, found that cardiovascular disease are incredibly common, probably the most common comorbidity in an outpatient clinic. And here's the data from our survey, which published as a poster a few years ago, that's showing that again, even in outpatient practice, right? Most people, 50% of individuals, close to 50% of those who surveyed say that 50% or more of their cases had 2 or more risk factors. And obviously this increases if we look at non-outpatient settings like acute care, SNF, home health. Again, SNFs, acute care, these are places where people are a little bit more medically complex, right? So we see a little bit higher prevalence, close to 80%, 85%. Still a big concern here, right? Still a big concern here. Now, again, frequencies, patients 2 or more risk factors on evaluation. Again, 2 to 3 times per week. You're seeing this pretty often. And if you're a direct access state, you gotta be screening. You might be the first healthcare provider that person's seen in years, right? So we're seeing this more, and we're seeing this often. And there's a large portion, close to 30%, that are seeing patients with these risk factors or diagnosed cardiovascular disease outright daily. And again, looking at common age range, like I mentioned, you're probably going to be treating patients who are over the age of 46. And if you remember that graph, when we start getting past 46 and, especially at age 55 and older, we see the prevalence is at 40%, or higher for hypertension. This is something we're going to be seeing incredibly often. Again, look at the populations we're seeing, right, in terms of individuals with disabilities, individuals, especially with mobility disabilities, individuals who are older. These are patients you're seeing, even in outpatient. And obviously this rate increases in terms of age, according to the center with your SNFs and your acute care, seeing a much older population generally, right? Your home health, SNFs, close to 100% of your patients are over 55. So if you're in those settings, you absolutely need to screen, but you need to screen an outpatient too. And I think what illustrates this point is a little figure we've made here, that some of the most common risk factors, right, for cardiovascular disease, inactivity, obesity, smoking, diabetes, cardiovascular disease, hypertension, these are risk factors for it. These contribute to it, right? Now, while they may not contribute to low back pain, tendinopathy or osteoarthritis, they're actually very frequently encountered. You even include hyperlipidemia, and I think for the tendinopathy research, right? So the most common risk factors for cardiovascular disease are some of the most common risk markers, frequent comorbidities seen in these 3 probably most common conditions that we treat even as outpatient physical therapists. Low back pain, hip and knee osteoarthritis, and tendinopathy is like 80% of the things that we treat as PTs. right? So again, and there's this common connection here, of healthy living behaviors, most notably inactivity. And honestly, if we often improve someone's activity profile, we can address a lot of these things, right? So again, thinking whole patient. Think of the patients that are coming to us. Most of our patients that come to us are obese, are inactive, right? And inactivity contributes to a lot of these things, right? I mean, some of these are, obesity, smoking, diabetes may not contribute to low back pain necessarily, or osteoarthritis necessarily, but inactivity does, right? And again, there's this common link, and I think we've got a very, we have a unique position in the healthcare system to be advocates, right? To educate our patients, to move more, to be healthier. And it starts with screening to even recognize if these patients are safe to receive our services. So we'll end here, and we'll get into the next section. And hopefully as we go throughout this lecture, it'll become quite apparent to you guys why it's so important that we're screening, because again, it's rare for you to not see these patients, right? And again, there's a lot that we can do, not only to improve, maybe the direct reason why they're referred to us or seeking our services, but as well as their overall health. And I think that's pretty important too.